Good day, everyone. For this week's lecture, we will be discussing how to handle sharps properly and how to manage any sharps-related injuries. When we talk about sharps, these are objects that can penetrate a worker's skin, such as your needles, scalpels, broken glass, capillary tubes, and exposed ends of dental wires. Contaminated sharps must never be sheared or broken. Recapping, bending, or removing needles is permissible only if there is no feasible alternative or if such actions are required for a specific medical or dental procedure. If recapping, bending, or removal is necessary, employers or healthcare workers must ensure that you either use a mechanical device or a one-handed technique. Now, in one-handed technique, the cup must not be held in one hand while guiding the sharp into it or placing it over the sharp. A one-handed scoop technique uses the needle itself to pick up the cup, and then the cup is pushed against a hard surface to ensure a tight fit onto the device. Healthcare worker must also ensure that contaminated sharps are disposed of in sharps disposal containers immediately or as soon as feasible after use. Our sharps disposal containers must be readily accessible and located as close as feasible to the area where sharps will be used. If we are going to dispose sharps container, make sure that you're not going to hold the sharps container at the bottom of the content compartments. Instead, hold it near the top because we might never know that maybe there are some sharps that went through to the container, especially if the product is not that really sturdy or quality is not good. There might be any sharps that will get through the plastic container and you might be injured. And always remember the criteria on when to dispose our sharps container. First is if it's 3/4 full already, if there is any odor arousing from the container, if the outside part of our container is visually contaminated, or if there is any splashes of blood or any dirt outside our container, then we need to dispose the sharps container. And do not forget that it should be labeled with the department, date and time as before putting our sharps container or any waste to the waste holding area. Now, as you can see on the slide, these are the things that we need to remember as healthcare workers, especially nurses, doctors, laboratory technicians that are handling, for sure we are handling needles. That first is we need to practice safe handling of needles. First, do not recap the needle. Do not touch the needle. Do not leave the needle inside the vial. And do not dispose of needles in anything other than sharps container. We have instances already that we found needle that is being disposed in yellow bags or black bags, which resulted to injury, especially to our housekeepers. And change the containers when 3/4 full already. Okay, these are the things that we need to remember to promote or to guide us on how to handle sharps safely. If we are able to practice safe handling of sharps, then most probably we will be preventing needle stick injuries. Other things that we need to take into consideration in order for us to prevent needle stick injuries is first, again, do not resheath needles. Never leave needles unattended. Avoid passing unsheathed needles between staff. Plan for safe handling and disposals of needles before giving the injection. So you need to plan your activities, especially if you will be dealing with needles or any sharp objects. Avoid using injections where oral medication can be used. Do not overfill safety boxes. And always dispose of needles appropriately in a safety box. Now, if accidentally or unfortunately we get pricked or we get injured by any sharp objects, especially our needles, these are the things that we need to take into consideration on how to manage sharp injuries. What I have mentioned, as what I have mentioned, if blood or other potentially infectious materials are present or may be present on the sharp, it is a contaminated sharp and appropriate personal protective equipment must be worn. Okay, as long as, especially if the needle came in contact with the patient already, then we can consider those sharp objects as contaminated. Remember, a needle stick or a cut from a contaminated sharp can result in a worker being infected with human immunodeficiency virus or your HIV, hepatitis B virus, hepatitis C virus, and other bloodborne pathogens. So always remember, guys, to make safety, especially for yourself, your biggest or your number one priority. That is why we need to prevent injury and reduce the risk of infection, especially bloodborne infections. So in cases that you get injured with any sharp objects, what are you going to do? First is healthcare worker should adhere with the following activities or steps immediately after exposure. Number one is do not apply pressure. Allow the wound to bleed freely, okay? Number two, wash the wound or the fluids with soap and water. Apply isopropyl alcohol 70% and bandage appropriately for sharps-related injuries. Now, if exposure to mucocutaneous and non-intact skin occur, so the first thing that you're going to do is wash nose, mouth, or non-intact skin with running water, running tap water. Irrigate eyes with clean or sterile water or saline solution. And flush site for at least 10 minutes. Do not forget. Once you finish your first aid intervention with your injury, the next step that you're going to follow is you need to identify source patient involved for evaluation of any possible infection if you know the source patient. Report the injury immediately to the senior staff on duty. Do not wait until the end of the shift or the end of the procedure. You need to report it immediately. If the source patient is known, secure 5 ml of source patient's blood for HIV, hepatitis B, and hepatitis C testing after obtaining patient's consent. Next is seek medical treatment and assessment immediately by reporting to the employee health clinic or emergency department. Then the exposed employee will fill out the needle stick and sharp object injury or blood and body fluids exposure report form. You will see later in the next slides the form, the example of the form. Then exposed employee will fill out the exposure to blood and body fluids notification form to evaluate for the potential to transmit HBV, HCV, and hepatitis HIV on the type of body substance involved in the route and severity of the exposure. Then collect and submit blood sample for the exposed staff for baseline data for HBsAg, anti-HBs, anti-HCV, and HIV. Then the exposure or the incident will be reported through OVR or your occurrence variance report to the Quality and Patient Safety Department. Then follow-up testing will be conducted at 6th, 12th, and 24th weeks after exposure, especially if the source patient is positive or unknown. Then last is counsel exposed staff on the risk of bloodborne pathogens transmission and post-exposure prophylaxis. On the slide is the form that you need to fill out once you are exposed to any sharps-related injury or blood and body fluids. So these are the forms. This is the first one. Then this is the second one. So you need to fill out correctly and appropriately as much as possible. This is the demographics, especially which you are going to write the name of the injured staff, your vaccination history, and the source patient's data. Then on the slide, these are the recommended post-exposure prophylaxis for hepatitis B virus. Now, if your status is you are unvaccinated, then the source patient is HBsAg positive, then we will be giving you hepatitis B immunoglobulin and initiate hepatitis B vaccine series. So series will be given from 0, 1, and 6. Okay? So today, then after 1 month, then after 6 months. If you are unvaccinated, then the source patient is SBHAG negative, it's non-reactive, then we need to initiate hepatitis B vaccine series. And if the patient is unknown, initiate hepatitis B vaccine series. Okay? If your status is you are previously vaccinated and you are a known responder, there's no treatment required regardless if the patient is unknown, positive, or negative. If you have received series of vaccination with hepatitis B and you are a known responder, even though you have 2 series already of hepatitis B vaccine, but still your anti-HBs is still low, then if the patient is positive, then we will be giving you 2 doses of your hepatitis B immunoglobulin or 1 dose of hepatitis B immunoglobulin, and we need to initiate again a revaccination or series of hepatitis B vaccine. If the patient is negative, then there's no treatment required. If unknown, if known high risk source, if the patient is, or if known that the patient is high risk, then treat as if source were HBsAg positive. If your status is if you don't know your antibody or how much is the level of your anti-HBs, if the source patient is positive, then we need to test you, the healthcare worker that is exposed, for anti-HBs. If your anti-HBs is adequate, then there's no treatment required. If it's inadequate, then we will be giving you hepatitis B immunoglobulin and a vaccine booster. And if the source patient is negative, then we need to test the exposed person, the employee, for anti-HBs again. If adequate, no treatment. If inadequate, then we need to initiate vaccination, at least a series of your hepatitis B vaccine. If unknown, still the same management if the patient is HBsAg negative. Keep in mind, guys, that your safety and your health should be always your main priority. Okay? Because bloodborne pathogens usually, once you get infected, it is very hard to take out into your bloodstream or into your body. So make sure that you will be always smart with sharps. So that ends our lecture for this topic. I hope that you have learned something. And aside from infection control lecture, this one regarding sharps and management of any sharps injuries is also interrelated with our employee health clinic. So this is one of the topic of the employee health clinic as well. And I hope that we will not be, the department, and will not be receiving any reports regarding incidents of any sharps injuries. And I hope that everyone will be practicing on how to safely manage and dispose any sharps objects. And for that, thank you and God bless. I hope to see you again next week for another lecture.